It is estimated that more than 90 million people in North America snore while sleeping. When you consider the snorer's spouse and children, nearly 180 million people are negatively affected by snoring every night. Does this sound familiar? If so, there's now a solution for a more restful night's sleep called Silent Nite. Silent Nite is a thin, flexible, custom-made snore prevention device. Here to tell you more about this amazing device is Ron Fichter.
I'm Ron Fichter, and for the next few minutes I'm going to explain what snoring is and show you how easy it is to prevent. Today, thanks to extensive research, your dentist can prescribe an affordable, custom-made anti-snoring device called Silent Nite. But what causes snoring, and how does Silent Nite work? Well, it's pretty simple. During sleep, the muscles and soft tissue in the throat and mouth relax, making the airway smaller. For people who snore, this airway is reduced to the point where air is constricted and moves at a high speed, vibrating soft tissues in the throat and making noise. Silent Nite corrects this using a device which moves the jaw into a forward position, increasing the size of the airway. This reduces air, velocity, vibration, and snoring. In clinical studies, success rates vary from 70 to 100%. Silent Nite is constructed from impressions of your mouth and requires only 2 appointments. These impressions are poured in a special dental stone which provides the dental technician with models and information of your own mouth. This device consists of 2 unobtrusive soft plastic forms which fit over your upper and lower teeth. These are attached by short connectors that hold the lower jaw forward during sleep, preventing snoring. It does not interfere with breathing through the mouth at all, even in cases of blocked nasal passages. But in certain cases where the airway is blocked completely for periods of longer than 10 seconds, you may have sleep apnea. If you suspect this condition, you should see a medical doctor. In other cases, studies have shown that excess body weight, alcohol, or sedatives can increase the severity of snoring. Another answer for some people is surgery, but this has a very low success rate and only works really well for people who have a recessed lower jaw. The truth is, the best solution for the majority of snorers is the dentist-prescribed Silent Nite. Now, before we end, let's hear from Tom and Susie Gall, who are both sleeping better due to Silent Nite.
The first part of our relationship was great. I don't know if he didn't sleep or what, but he certainly didn't snore. And then about 6 or 9 months into it, he did. He started snoring, and it was very difficult for me to sleep. And it got to the point where I was nudging him out of bed to go sleep in the other room, or I was just getting up frustrated and sleeping in the other room. And I tried everything. I tried putting my head, you're reading Glamour and, you know, everything in Cosmo and all these hints for snorers. And one of the things I tried was putting my head at the foot of the bed and my feet at the head of the bed. I mean, I tried this a couple of times, and it actually worked. It kind of numbed it, you know, and you put a pillow over your head. And for the longest time, I slept like that. You know what? It wasn't as much tense when you're going to bed. I felt it was more tense waking up in the morning. And I'd wake up, and I just felt horrible. And I knew why I felt horrible is because my husband was just keeping me awake at night from snoring.
I would try all different kinds of things. I would try and put my head under a pillow and try and block the sound, prop my head up on pillows, sleep in the other room, and I mean, everything you could possibly think of. And then I finally tried the Silent Nite. The first time I put the Silent Nite in my mouth, I was expecting it to be uncomfortable like the other products I tried. And I was surprised that I became accustomed to it almost immediately. I could feel it in there, and then all of a sudden, I was asleep. And I couldn't believe that I was asleep that fast without any discomfort or worrying about, you know, waking myself up. And I didn't wake myself up. And since then, I wear it, and I don't wake myself up. She gets better night's sleep, and we're just better for it. It has really improved our relationship.
Didn't tell me that he had it on. And I kissed him goodnight, and everything, it was really pretty interesting. And I'm thinking, oh, here we go again. And I went to bed and I slept straight through it. And then in the morning I saw the little blue case, and it was on his nightstand, and it was the night, and I didn't even notice that he had it in or anything. It was really, and I slept. I am a very firm believer in Silent Night's effectiveness. Having tried many other products, I just feel that it's superior, and it's definitely helped our marriage and our relationship and how we communicate. It's wonderful.
Silent Night is an easy and effective way to prevent snoring. Not only is Silent Night effective, clinical studies show that Silent Night helps rid snoring in 8 out of 10 patients. Ask your dentist for more information. Your dentist may request you complete a short checklist, which will be used to determine the exact design of your Silent Night. Now you can rest better, sleep better, and live better thanks to Silent Night.